tonight's 7 Upfront segment, we are taking a closer look at where our state stands in the fight against this virus. And we're joined now by MDHHS Director Elizabeth Hertel. Director Hertel, thank you so much for being with us again tonight. Let's jump right into it with schools, because we are understanding the department has just issued new guidance in the last hour. So tell us what's changed.
So we want to make sure that children are staying in school when they can, if the risk is mitigated, but also ensuring that we're mitigating that risk to other students. So testing early, staying home, quarantining, isolating for the shorter period of time as directed by the CDC for the general public, and then incorporating that testing into the process so that we know kids, if they've been exposed, we can keep track and they can find out early. And we are helping those schools, making sure that they have the test to give to the families so that they can identify those cases early on.
And Michigan is seeing record hospitalizations. Now, since Omicron appears to be less severe, more mild, if you will, is that translating to a smaller percentage of patients in the ICU?
It is translating to a smaller percentage of patients, but we have a larger pool of patients getting, contracting Omicron. So it potentially could be more than we saw with Delta. It does seem that Omicron is less severe, but that isn't always the case. And we want to ensure that people are taking steps to protect themselves and their families so that we are not seeing more people going into the hospital.
Sure. It feels like we are at a peak of some sort right now. Any indication regarding how long this particular wave could last?
We are not near the peak yet. We will continue to go up. Our modeling looks maybe like 2 or 3 weeks here. I think people need to be prepared to see our case rates increase significantly over the next 10 days.
2 or 3 weeks. Wow. And there's been some confusion about whether or not you need to report a positive result from home tests. We know these are becoming more ubiquitous. People are getting their hands on them now. Is that necessary?
It's helpful if they're reported to the health department. However, if you test positive at home, we would encourage you to get a PCR test to make sure that you're verifying that test. And we'd also encourage you right away to make sure that you notify any of your own close contacts so that they can test themselves.
All right, the COVID saga continues, unfortunately. Thank you so much, MDHHS Director Elizabeth Hertel. Appreciate your time.
Thank you.